What I'd like to speak about today is lower back pain. Now, lower back pain, unfortunately, is a huge problem in the UK. It affects 80% of people at some point in their life, and the British Chiropractic Association estimate that currently 30% of the entire UK population are suffering with lower back pain. Now, what I'd like to cover are the most common causes of lower back pain and how chiropractic care can help. So, what we've got here is an upright skeleton. Now, the lower back is the bottom 5 vertebrae, and that essentially sits on top of the pelvis. Now, if we look more specifically at the lower back, one of the most common reasons for lower back pain is joint dysfunction. Now, joint dysfunction would typically present as lower back pain that is worse in the morning, generally eases up as the day goes on, whereas a more muscular cause of lower back pain would be something that's actually quite fine in the morning, but generally gets worse as the day goes on. And the reason is that joints are designed as hinges. They tend to like movement, so they tend to benefit from being up and about, whereas muscles that are tight generally don't like to be used too much. They prefer rest, which is why predominantly muscular causes are actually better first thing in the morning. Now, more often than not, a patient will come in and they have back pain for various reasons, but the end result is that they have this joint dysfunction that tends to be the cause of most types of lower back pain. Now, if we pluck out the lower 2 vertebrae and actually look at those in more detail, we can see that you've got your joint on the right lower back, left lower back. Round at the front, you've got your discs. The discs essentially are there to bear weight, to keep the joints moving freely. Now, a lot of the time, people will come in with long-term lower back pain, perhaps they're in their 30s, their 40s, their 50s, and what has happened is that the disc has essentially thinned out a little bit, and what this means is that you've got less ability to cushion the weight between the vertebrae, and the consequence is that these joints end up bearing weight. Now, that's okay to begin with. That's okay in the early days because you've got lots and lots of muscles and ligaments and tendons that can compensate for that. But as time goes on, symptoms will develop. And like I said, those symptoms generally are aching, stiffness, and if you're unlucky, potentially sciatica as well, due to irritation of these spinal nerves. Now, another common reason for joint dysfunction is weakness in the core muscles. And unfortunately, because so many people are sat at a desk, sat on a computer these days, perhaps sat on a train to and from work, sat on the M25 going up and down to their office. A lot of people these days are sitting and sitting a lot. So let me just share with you how that affects the muscle tone around the lower back. Now, the rectus abdominis muscles, which are obviously the tummy muscles, these sit at the front of the spine, and like every muscle in the human body, it has its antagonist. So in other words, it's got a partner. So with bicep, you've got tricep. With your thigh muscles, you've got your hamstrings. And with the tummy muscles, you've got the back muscles. Now, the effect of being sedentary, the effect of actually just lack of exercise, means that generally people get a little weak around the front here. Maybe they get a little bit of a belly. The consequence is that because the core muscles support the lower back, if you've got weak core muscles at the front, then you're going to develop tight back muscles to try and support this spine. And it's those tight back muscles that end up restricting spinal joint movement. So that's basically another common problem in chronic lower back pain. So just to summarise, most cases of chronic lower back pain are due to joint dysfunction in the lower back. Chiropractors are trained to assess joint mobility, and they're also trained to assess the causes of joint mobility. And they're also trained to assess the causes of joint dysfunction. Now, those causes may be weak core muscles, they may be thin discs. Depending on your age, we can x-ray your lower back and actually assess the structural integrity of the spine. So just to summarise, most causes of lower back pain are actually down to joint dysfunction in the lower back. Now, as mentioned, joint dysfunction can be a byproduct of thinning discs as you age. It can be a byproduct of weak core muscles. It can also just be a byproduct of lack of exercise. So here at the clinic in Dorking, like I said before, we will not only diagnose the problem, but we will try and find out how we can advise you to complement the treatment to avoid the problem coming back again in the future.